Hey, good afternoon, everybody. Tim Walsh coming to you live from the Illinois Fire Service Institute on the campus of the University of Illinois, where today we're going to be highlighting Illini Emergency Medical Services here on our campus and across the country. So we're going to let you get signed in. Today's handouts will be posted in the comments section so you can follow along. I'm asking fire departments and emergency medical services all across the state to post this on your Facebook page. We're actually going to be delivering some live hands-on training for hands-only CPR and stop the bleed. And with fire departments not being able to speak to their communities, this training can have an impact on your local community, the people that you take care of, and their loved ones. So we'll see you back here in a minute. Hey, good afternoon, everybody. Tim Walsh coming to you live from the Illinois Fire Service Institute on the campus of the University of Illinois, where today we're going to be highlighting our program instructors from Illini Emergency Medical Services. They're a standby organization and a teaching organization, part of the Illinois Fire Service Institute, that deliver programs all across the state and especially here on campus. The stuff that we're going to be talking about today, hands-only CPR and stop the bleed, is very important for people that live all across the country or even across the world. This is easy information to remember, stuff that we're going to be teaching you today, and stuff that you can use after this program is over. So let's get started. Let's introduce our instructors, and we'll move along today. So thanks for joining us. Check out the comments section for handouts.
Hello everyone, my name is Niraj Lawande and I'm an instructor for the Illinois Fire Service Institute as well as Illini Emergency Medical Services. Throughout the state of Illinois, I'm licensed as an EMT and I'm also a nationally certified instructor for the American Heart Association and the Emergency Care and Safety Institute.
Good afternoon, everyone. My name is Sean McAllister. I am the current president for Illini Emergency Medical Services through the Illinois Fire Service Institute. I'm an instructor through the Illinois Fire Service Institute for IEMS, where I function as a nationally certified American Heart Association BLS instructor, as well as a Stop the Bleed instructor.
Hey, Sean, stay here for a minute for me, and let's kind of talk about what Illinois EMS does.
Sure.
So who are you?
So we're a student-based collegiate EMS organization as a program under the Illinois Fire Service Institute, where we function to provide BLS non-transport care for the members of our community on campus here.
Okay, and what are some of the other things you do, and why is it so unique as to what you do?
Sure, so we also provide a lot of educational courses here on campus. That includes AHA, BLS classes, first aid classes, an EMT class as well. And it's really kind of unique because we're one of the only Big Ten schools to actually provide this kind of care and functioning for our organization, as well as being a student-ran EMS collegiate organization as well.
And who's our overarching responsibility here as a partner, not only as a partner of the Institute and a partner of Illinois Emergency Medical Services, but who supervises what we do to make sure the message that we're teaching is correct?
So we have a couple of different governing organizations, if you will. The Illinois Fire Service Institute, obviously, being a program under them, is one of the biggest ones, as well as oversight from Carl Regional EMS System, as well as the American Heart Association.
Great, and Carl's one of our partners here. They just donated a brand new ambulance for you guys to operate in here on campus. So that's a great thing. And let's talk about one more thing before we get started today. There's an international app that we use here on campus called Pulse Point. And let's talk a little bit about how that operates and why it's important for people all across the world.
Sure. So PulsePoint is an app that can be found on the App Store, Google Play, all those kind of app-based services, where you can download that, and it not only provides quick and easy access to AEDs all across campus here, but if it's available in your region, then being able to access those AEDs there as well, so that you know where those life-saving items are in those times of emergency.
And then lastly, this is one of the highest recognized national collegiate EMS programs in the country. Let's talk about the awards that you guys have gotten while you've been here, and the students that came before you and the students that came after you that helped deliver this information.
Absolutely. So as well as being recognized by the National Collegiate EMS Foundation for being a heart-safe campus, as well as an EMS-ready campus, we've been recognized with the Congressional Fire Service Institute through the Massimo Award in Excellence in Fire-Based EMS.
Great, so let's get Niraj back on here. Niraj, I'll go this way. Sean, you come this way with me, and we'll start our demonstration today on hands-only CPR. Niraj?
Hello everyone. So today I'm really excited to talk about hands-only CPR and this life-saving technique that everyone in the community can use to help save a life. So when you use CPR, so CPR stands for cardiopulmonary resuscitation, and this is a technique that can be used for someone who's experiencing cardiac arrest. So let's go ahead and dissect the difference between a heart attack and cardiac arrest. A heart attack is a problem that occurs when the heart isn't able to receive oxygenated blood. And so when this happens, the heart may stop functioning. A cardiac arrest can occur at any time, and this is when there's an electrical problem going on with the heart. So in order to fix a cardiac arrest, we're going to need to use electricity in the form of an automated external defibrillator to help bring that patient back. So just a little bit of numbers to put this into perspective and why this is important. According to the American Heart Association, there have been over 350,000 sudden cardiac arrests each year. On top of that, and even more importantly, 70% of these out-of-hospital cardiac arrests occur in homes. Knowing this information, it's important that everyone in the community can be trained in hands-only CPR. And you never know when you may have to use this. As I said, 70% occur in homes, and in your home, EMS isn't always going to be ready for you. So if we can make sure that everyone in the community is trained in hands-only CPR, we can skyrocket the numbers of survivals after a cardiac arrest. So the first thing we're going to talk about is, what does CPR do? So as I said, in a cardiac arrest, there's an electrical problem preventing the heart from doing its main function. The heart's main function is to pump oxygenated blood to the rest of the body. And so if you imagine your heart squeezes, and that squeezing pumps out the blood to the rest of the body. However, when that heart can't operate, we are going to compress the chest, in effect squeezing the heart so that the blood can travel to the rest of the body. And that's why it's so important to begin CPR right away. All of our organs in our body need oxygenated blood, and most importantly, our brain requires a lot of oxygen. So for each minute that you delay CPR, there's a decrease in survival. And so what we're hoping to do today is teach you guys a simple technique that you can all implement into your lifestyles, so that way hands-only CPR can be initiated right away. So first, I'm going to talk about the 3 steps that are involved in performing hands-only CPR. So the first step is to make sure that you are in a safe environment. And again, I want to reiterate, the reason you would perform hands-only CPR is if you find an individual who is motionless and not breathing. Typically, we reserve hands-only CPR for adults and teenagers, and that is what the AHA recommends. So going back to the 3 steps. First, you want to make sure the scene is safe. Why do we want to do that? Well, if you are unable to provide care due to the unsafe environment, that can lead to 2 patients rather than 1. When you're there providing CPR, your goal is to help that patient, and you can only do that if you are able to provide that care. So before we start doing anything, we're going to want to make sure that the environment is safe, so that way we know that we can provide the best care to the patient as possible. Once you have established that, you're going to want to ask someone to call 911. 911 will be able to guide you through this process too, and they are usually trained in CPR and also trained in training individuals in CPR. So if you forget any of the steps we talk about today, remember that 911 can help you through this. In addition to calling 911, you should appoint someone to go get an AED. The automated external defibrillator, or the AED, looks like this, and I'll get into more details about how to use that later. So step 2, I'm going to direct someone to call 911 and get an AED. If that is not an option, if you're the only person who's available in that room, you can call 911 yourself. The third step, and the most important step, is to start pushing hard and fast on the center of the chest, like so. So some things to keep in mind when you're pushing hard and fast on the center of the chest. You're going to want to place your hands in between the two nipples of your patient, and the other thing is you're going to want to make sure that you're going at a rate of 100 to 120 beats per minute. Now, not all of us are musical metronomes, so the best way of remembering what this is to think of the song Staying Alive by the Bee Gees. This song is a nationally recognized song due to it going at 100 beats per minute, and that is a great guide for the rate that you should be going at when you're performing CPR. Another thing to keep in mind is the heart. What we're doing is we're squeezing the heart to pump blood out. So we want to make sure we're actually pushing the chest enough to squeeze the heart. So we're going to want to aim for a depth of greater than 2 inches, or another way of thinking about it is a third of the chest. So once we do those 3 things, that is how we've initiated hands-only CPR. So to review, we're going to be doing 1, making sure that the scene is safe. 2, we're going to want to call 911 and appoint someone to get an AED. And 3, push hard and fast on the center of the chest. Now we're going to keep doing this until 4 things may happen. The first is that after you call 911, the EMS agencies can respond. When they respond, they will be able to take over care for that patient. And they may relieve you of your duties, or they may ask you to assist. And in that case, that care has been transferred over to the EMS agency. Another reason to stop CPR is if you are too physically tired. Now, in a minute, my colleague Sean and I are going to be demonstrating CPR, and you guys might be able to recognize that this is very physically demanding. Doing CPR for over 2 minutes is a very demanding process, and if you're by yourself, you need to also keep in perspective your own health, and you don't want to compromise that. So if someone else is in the area with you, you may be able to ask them to come and help out with the situation, but that is something we want to keep in mind in terms of if we need to stop delivering CPR. A third reason to stop delivering CPR is if they regain consciousness. And now, that's the expected outcome. We're starting CPR because they're in cardiac arrest, and we're hoping that by our actions, we're able to help them regain consciousness. So if that does happen, obviously your patient is not going to be comfortable if you're pushing on their chest and they're waking back up. So that's the third option. The fourth one is earlier, you would have asked someone to go get you an AED. The AED stands for an automated external defibrillator. And if they come back and bring the AED, you're going to want to apply that right away. CPR can help sustain someone in the condition that they're in, but as I mentioned, cardiac arrest is an electrical problem. The majority of times, the only thing that's going to get them out of that state is by shocking their heart, and that's what this device does right here. So this is an automated external defibrillator, and for those of you who watch medical TV shows on TV, they have defibrillator paddles that they manually set. What this device does is this does all of that automated. So this will walk you through everything you need to do, and this is one of the most user-friendly machines in all of community-based medicine. So I'm going to open this up here and let you guys see what's in it. So in our AEDs, we'll typically have some sort of pad, and we'll also have some sort of AED device. Now, they may all look a little bit different, but for the most part, they all have the very same functionality to recognize specific heart rhythms and shock the heart when necessary. AEDs may include additional things like razors if necessary to shave a very hairy chest, or there might be other things that you may need depending on the situation. But for the bulk of the matter, these are the 2 most important things. So when you get an AED, I'm going to set it down now, and so I can demonstrate what we're going to do. The first thing you're going to want to do is turn the device on. Some AEDs may automatically turn on when you open them. Others will have a very obvious power button that you just need to turn on and make sure that the device turns on. The first thing that the device is going to tell you to do is apply the pads to the patient's bare chest. So the pads come like this, and they also plug into the actual device like so. So with these pads, we're going to take them out, and keep in mind that these pads are labeled. The first thing I said when I was talking about an AED is that they're very user-friendly. So as soon as you get one, just follow the directions. Everything is on there, and all you need to do is already right there in front of you. So I'm going to take these 2 pads, and this first pad labeled here is I'm going to pull up this mannequin for you guys to see and show you. So this first pad is going to go in this quadrant of the chest, and then the second pad will go in the lower left. And the reason for this is to show, is to allow the electricity to pass through the heart, right? The reason that the patient is in this condition is because they have some sort of electrical problem. And by using this AED, we can shock the heart, allow it to restart, and hope that it will bring the patient back. So this is just briefly how to use an AED. The next thing we're gonna do is allow a live demonstration, and we'll hope you guys can see that.
Okay, so while we're getting the AED packed back up and Niraj and Sean get set up, we're just gonna go over this real time. There'll be no narration. We want you to see exactly how to approach a downed patient wherever you may live in the world and how to effect a rescue with hands-only CPR and an AED. So guys, are you all set?
Just another minute here.
Okay, as soon as Niraj is ready, then we'll go ahead and demo for you. We're just about set. I think Niraj is ready, Sean's ready. All right, guys, let's go ahead.
Sir, are you okay? Are you okay? I see no response, and I do not see the patient breathing. The scene is safe, so I'm gonna direct Sean, call 911 and get me an AED.
I have an AED.
Can you put that on while I continue to do compressions?
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
All right, the pads are on.
Analyzing heart rhythm. Do not touch the patient.
Clear.
Clear.
Shock advised. Charging. Stay clear of patient.
Clear.
Clear.
Deliver shock now. Press the shock delivered.
Sean, I'm getting a bit tired. Can you take over compressions?
Yes, I
Begin
can.
CPR.
Now this format would continue, and Niraj is going to talk about now until they're relieved by either an EMS agency, or you're too tired, or the other options that Niraj talked about earlier. So go ahead, Sean, let's stop. Let's have Niraj tidy this up a little bit, and you can see how physically demanding it is to do proper CPR. And Niraj will talk a little bit about it. In a hospital setting, in an EMS setting, this is a team aspect. We switch out the compressor all the time because it takes a lot of effort. Niraj, would you please talk about that?
Yes. So there are higher levels of CPR than what we're training you in today. And the focus of these trainings typically involve the team format. The reason this is so important is because, as was just mentioned, this is a very physically demanding activity. And so the best case scenario is if you can have a partner that's gonna help you out and switch out with you until EMS agencies get there, that's gonna provide the best care. Because it's one thing to provide CPR, and it's one thing to provide high quality CPR. And by constantly changing out, we're gonna make sure that the CPR we're delivering is very high quality and effective.
Great, so before we move on, Niraj, let's talk about, in the COVID-19 climate that we're dealing in, why hands-only CPR is really an important tool to make rescues and save lives.
That's a great question. So hands-only CPR, I'm gonna start off by acknowledging why perform hands-only CPR in general. Then I'm gonna go ahead and take that one step further and talk about why that's especially relevant during the COVID-19 pandemic. So recent studies published by the American Heart Association have shown that in the first few minutes of care for an out-of-hospital cardiac arrest, survival is not affected by hands-only CPR versus traditional CPR. So what that means from our perspective is for the general public, if you can just initiate hands-only CPR right away, the patient for the first few minutes of care has the same odds. So in that sense, hands-only CPR is much more simpler, and we're hoping today that by teaching you guys a more simple technique that you can easily remember with just 3 steps, you will be much more willing to initiate CPR and know that what you're doing has the same effective odds. Now, to address to the COVID-19 question that you guys that was brought up, now obviously, there is this respiratory viral particle that's being transmitted, and especially if there's a person on the ground that you do not know, you have no idea what the condition is, and you don't want to ever risk your own safety. So the current recommendations for CPR on an individual that you're not familiar with involve hands-only CPR. What you can do is take a mask, throw it on your patient's mouth, and then you yourself wear a mask, which I'm going to take off for the purposes of explanation. And by allowing that, you can make sure that you're safe while delivering the care that the patient needs. So next up, I'm going to go ahead and talk about a recent project that Illini Emergency Medical Services has been working on in partnership with the costume shop at the Krannert Center for Performing Arts. CPR can be needed at any time. Anyone can go into cardiac arrest at any time. And it's important we acknowledge that it can happen to anyone of any age and to men and women. Traditionally, CPR has always been taught on male mannequins. But the reality is, because this can happen to anyone, our goal is to train people to respond to these emergencies on all types of bodies. So recently, the costume shop at the Krannert Center for Performing Arts at the University of Illinois has developed this mannequin, this vest that we can use. And the intent is to show people that CPR is no different when you're performing it on a woman or a man. So what we have here is a mannequin with breasts on it. And yes, it does sort of affect the position that you put your hands in, but at the end of the day, you're doing the same exact thing. You're pushing hard and fast on the center of the chest. Recent studies have shown that people are 27% less likely to initiate CPR on women. And our goal as Illini Emergency Medical Services is to help bridge this gap. And we want to make sure that people are willing to get CPR initiated on all types of people. And that is our goal.
Great, Raj, why don't you go this way here and just talk to me for a minute before we get Sean back on. So all these classes are available, obviously, at the university, correct? How would we sign up for something like this?
Yes, so we teach these classes on a weekly and monthly basis, and we teach classes of all forms. And so the way to do this would be to go to fsi.illinois.edu, and on that page we have a specific IMES page, where IMES stands for Illini Emergency Medical Services. When you visit that page, we have an education tab, and that lists all of the classes we currently offer. We currently offer courses through the American Heart Association and their basic life support class. This class is required for all healthcare providers and several people throughout the community. And so we do offer this class. However, that is a very detailed CPR class. So we certainly offer classes for people of all types trying to learn CPR. We offer first aid and CPR classes through the Emergency Care and Safety Institute. We also offer hands-only CPR classes. There are other classes we offer, which my colleague Sean will get into later.
Great, so let's get Sean in here. Sean, come on in, if you guys can switch places. And Sean, we're gonna move some of these mannequins down here a little bit so you got a little more room to operate. We're gonna get into our next subject area, which is Stop the Bleed. And on our campus here at the University of Illinois, in all our AED cabinets, is also a Stop the Bleed kit. So let's talk about a little bit about the history of Stop the Bleed, why we teach it, and what it's about.
Sure. So as Tim mentioned, Stop the Bleed originated from a very tragic moment in American history, the Sandy Hook mass shooting at the school there. And through this mass shooting, we learned that if we have kits in place that can be used to stop bleedings from traumatic injuries such as what happened at Sandy Hook, survival odds increase. So the Hartford Convention created this program called Stop the Bleed as a public service initiative to try to teach people basic wound care and stopping the bleed, which is one of the #1 preventable causes of death after traumatic injury. So here on the University of Illinois campus, we have these Stop the Bleed kits, which are located in the same cabinets as all the AEDs.
Great, and these AEDs and these Stop the Bleed kits could be anywhere in the world. So like some of our guests that are watching today from Portugal and Spain and fire departments all over the state of Illinois, and please let us know where you're watching from, guys, so we can talk to you. And if you have any questions, please fire them off. This could be available anywhere, not just on our campus, right? It could be available anywhere in the world.
Absolutely. So they come as commercial kits such as this one right here, but if you don't have the money or the resources to actually buy one of these kits, you can make your own very easily. The most basic of which could just be sticking some gauze in some Ziploc bags and placing them all around your community. And then you can get more advanced if you want to go ahead and buy, and we'll get into this later, tourniquets and other materials. Or if you do have the funds to do so, go ahead and buy these actual commercial kits that are available.
Great, so let's open up the kit, Sean. Let's
Sure.
have you teach the kit and actually teach application of what's inside the kit.
Absolutely. So the kits that we offer here on campus, which kind of like the ADs, there's lots of models out there. This is just one we're showing you, one of the most common ones as well. Open it up. There's going to be a quick tutorial guide. It's about a 4-step guide that'll teach you in the moment what you need to do and what's in this kit. Additionally, we have gloves for your protection as well as a blanket, so you can put that over your patient if they're getting cold or in some type of shock. Have compressed gauze, a Sharpie, a tourniquet, and hemostatic gauze. And the easiest way to explain what hemostatic gauze is simply is it's gauze that has an infusion of a certain chemical that promotes the clotting process to help stop that bleed at a chemical level. So like I said, those are located throughout our campus as well as hopefully you can get into posting them around your community as well. So this is our Stop the Bleed trainer right here. It has a variety of different types of injuries that you could see, something from like a weird looking wound to a puncture wound here, and as well as like a laceration right here. So there's also 3 basic steps for stopping the bleed. Firstly, as my colleague mentioned, Niraj, you want to ensure your own scene safety. If you can't help your patient, you will not be able to do any good. Secondly, you're going to want to call 911. You want to activate that 911 system. That way you have additional resources coming to help you after you're helping your patient. Next, you want to find the bleeding, or bleeding, B's for bleeding. So when we find our bleeding, we're going to use gauze, which we're going to use to compress that wound, which is what our C is going to stand for. So I'm going to use this laceration right here. I'm going to take this gauze and wrap that wound with this gauze here. That's not only absorbing the blood, but it's also going to give me that layer of compression that I can't necessarily just get with my hands alone. So after I'm finished wrapping this wound with this gauze, I'm going to take my hands and compress that wound, and that compression is also going to help stop that bleeding. So let's say our patient's still bleeding. I've got the gauze on there, I got my hands on there, they're still bleeding, we're not doing too well. What we can do is we can use additional gauze, such as these, and not remove the original gauze we have, because there could be clots still stuck in that gauze. We can put more gauze on there and still push down to get our compression that we need. Now, if that doesn't work, we can resort to a tourniquet. This is what a basic tourniquet looks like. There's a couple different models, but this is the one we're showing you guys today. So what we're going to do is we're going to open up the band right here, locate our wound, which you see right here. We're going to go about 2 to 3 inches above that wound and tighten this tourniquet on there as much as possible. Wrap that Velcro around, and now we're going to use this little wand thing called a windlass, and we're going to twist that windlass, which is going to get us that compression to stop the bleeding. And we twist that until that bleeding stops. That way we know that we're done. We don't need to twist it anymore. Finally, I kind of mentioned in our Stop the Bleed kit that there are Sharpies in there. What we're going to do is there's a place to write the time that this was applied. That's really important because evidence shows that you can have a tourniquet on from anywhere to 4 to 6 hours before any damage actually occurs to any of the cells under it. You know, we only have a wound right here, but this could be the rest of the limb. This is not injured, but we're still restricting that blood flow. Therefore, we could have potential injuries down the line. That way, if we write the time, we know as an advanced provider or in the hospital what time that was applied, so we know what window are we in. Are we in that window where this needs to come off ASAP because we're doing some further damage to uninjured parts, or are we still in that sweet spot? So that's the basic of stopping the bleed. I want to remind you that the biggest thing is assuring your safety, finding that bleeding, and then using compression to stop that bleeding. And if we need to, go ahead and go to your tourniquet here. So these steps can be found on a little handout that we have. We're going to post that in the comments section. Guys, print it out, put it in your firehouse, put it in your libraries, put it in your schools. These are really, really simple and quick things to know. And like I said, you guys can build your own kits and include that with that little handout all across the country.
Hey, Sean, if someone wanted to take this class and they're in the state of Illinois, how would they sign up for it? How would they go about it?
Sure. So they can go to fsi.illinois.edu to the same location that my colleague Niraj mentioned earlier under the IMS tab. We offer the Stop the Bleed course as a standalone course, which is about anywhere from a 20 to 30 minute course, and then we also offer it in conjunction with what we talked about just a minute ago with the hands-only CPR. So you can get both of those trainings put together in one class.
Okay, so we have one question that I'm going to handle. I'm not even going to ask you.
Sure.
It's about where these kits are available. And each different locality is different, like the city of Chicago, like different suburbs, like all over the world. A lot of times they're cohabitated with the AED, and that's kind of what we've done here as a standalone organization here on campus. they've put them with all the ADs here. So it's done a good job with that. But you have to look in your own central area to find out where those are at. Let's get Niraj back in here and we'll kind of talk about what we covered today, guys. Let's talk about the highlights of hands-only CPR, and then we'll talk about the highlights of Stop the Bleed.
All right, so when we're going to go review hands-only CPR, I want to make sure that all of you today are comfortable with the 3 steps that we discussed earlier. The first step is if you see a motionless and not breathing adult or teen, you're going to ensure that you have a safe environment. The second step is you're going to alert someone to call 911 and to grab an AED. And if there's no one else there, you should call 911 yourself. The third step is to push hard and fast on the center of the chest at a rate of 100 to 120 beats per minute. And you will continue doing this until either EMS arrives, an AED arrives, the patient recovers, and keeping these situations in mind, you're just going to continue doing CPR as long as you can. CPR is a wonderful tool that we all can use, and we hope that by listening to this today, you can start to implement more trainings like this in your community so that all of us can be trained in CPR and all of us have the ability to save a life if we're ever in that situation.
Great, thanks Niraj. Let's get Sean back on camera here. Sean, would you please cover the highlights of the Stop the Bleed program here that we taught today?
Yeah, absolutely. So, like Niraj said, we want to make sure that we're safe every time we administer patient care. So the biggest things for Stop the Bleed is we want to alert 911 to make sure we have those resources coming to help us. We can only do so much for our patients. 2 is find that bleeding. We got to locate the bleeding in order to stop it. And then 3 is going to be that compression. We want to use gauze to compress it, or if we need to, use a tourniquet. Now, one common question I do want to highlight is that, what if you don't have access to gauze? Can you still do this? You can in 2 capacities. One is if you don't have any tools whatsoever, you can just use your hands to try to stop that bleeding as much as possible, that compression. And that second one is you could just use a clean cloth, anything that you have available to supplement that gauze, as well as using that compression. But that compression is going to be the biggest tool to stop the bleed.
Hey Sean, we did have one question come in, so
Sure.
stay here for a minute for me. Talk about, I think I know the answer to this, but you're the expert. Are there any special certifications you need to take this class, Stop the Bleed, or can anybody sign up for it?
Absolutely, anyone could sign up for this. Just like the hands-only CPR classes that we offer, these are our more community-based classes. We want the community. We want you with no expertise or background at all to take these classes because these are the life-saving skills. So just if anyone can go ahead and take these classes and learn the skills necessary to hopefully prevent something terrible from happening.
Great, like so Sean says, all of this is available for fire departments and communities all across the state and all across the country, even by just sharing this video on your fire department webpage, your community EMS page. You can make a difference in your community just by showing what we taught you here and for signing up these classes which we teach here. So we want to thank our partners, Carl, the Illinois Dads Association that provides Stop the Bleed kits for our instructors here on campus, and the Massimo Award through the Congressional Fire Service Institute. All those organizations partner with the University of Illinois Fire Service Institute and Illinois Emergency Medical Services to be able to deliver classes like this anywhere we go. So everything we talked about today is posted in the comments section, handouts for you to teach along with, printouts that you could use for your babysitter in your community or for your children that are staying home alone. All of this information is available to you as a state fire training organization. So thanks for joining us today. We'll be back in a couple of weeks. Take care of each other out on the street and be safe.